Hi, this is Dr. Lee, and this is a pre-work video for the development of the kidneys. In this video, we'll cover just the 3 learning objectives to get you ready for the in-class learning event. To begin, let's look at which germ layer gives rise to the urinary system, for which we have to look at the 3rd week of developing embryo, the trilaminar germ disc form that is in the process of gastrulating. Recall the ravioli that is in the process of kind of folding during week 3. We have removed the top layer of the pasta and we're now looking into the mesoderm or the cheese layer of the ravioli. This structure would be the primitive streak. Off of the primitive node, we have the nodal cord that's growing towards, but not past the oropharyngeal membrane. Caudal to the primitive streak, we have the cloacal membrane. And on either side of the nodal cord, we have the paraxial mesoderm that gave rise to the vertebral bones and all the skeletal muscles of the body. Lateral to those, we had the pair of intermediate mesoderms, which we have been ignoring thus far. At the peripheral most region of this ravioli, we have the lateral plate mesoderm that goes all the way around the rim of the ravioli, which splits into dorsal, so out of the screen layer of the lateral plate mesoderm called the somatic LPM, and ventral region, so going into the screen, we would have the visceral LPM, and in between the 2 layers, we have tube or horseshoe-shaped space or tunnel called the intraembryonic coelom or cavity, which gives rise to the pericardium, pleura, and the peritoneum. Going back to what gives rise to the kidneys or the urinary system, the majority of the urinary system would be deriving from the intermediate mesoderm pairs. It's now all about the intermediate mesoderm and a little bit of the caudal-most GI structure called the cloaca. The main question here that we're going to discuss in the pre-work video is how do the streaks of intermediate mesoderm go from these bilateral structures to what we recognize as the urinary system, predominantly these 2 kidneys. These are actually fetal kidneys. You know that because the surface of the kidneys are kind of convoluted or lobulated looking. And these little dibbons will eventually go away as the histological structures of nephrons start to elongate and grow and mature and fill out these little dibbons. So in adult kidneys, we'll rarely see these depressions called the fetal lobulations, although some still retain some of those indentations. At any rate, all of these kidneys and all of the 2 ureters will come from the intermediate mesoderm, and a small triangular part of the urinary bladder on the dorsal aspect that's bounded by the entry points of the ureters and the opening into the urethra. That area called the trigone is actually also derived from the intermediate mesoderm. At least the epithelial lining is derived from the intermediate mesoderm, and the rest of the urinary bladder would be coming from the cloaca, which is the caudal-most portion of the gut tube. So the endoderm and splenic LPM or the visceral LPM is the rest of the bladder structures. A couple of other points to remember is the fact that the trilaminar germ disc is kind of flanked, if you will, by the 2 spaces. We have the amniotic cavity space, which is dorsal to the ectoderm, and the yolk sac, which is ventral to the trilaminar germ disc. And this is a sagittal section, so this would be the cranial portion of the developing embryo, and the connecting stalk being at the caudal-most region of the embryos. So this is a sagittal section of that double bubble structure during the 3rd week in development. One thing that we haven't exactly paid attention to before is this structure called allantois. This structure is a small diverticulum or blind-ended sac of the yolk sac that grows into the developing connecting stalk fairly early on during week 3. And as the embryo folds cranially and caudally, you'll recall that the cranial-most portion and the caudal-most portion of the embryo kind of gets pushed or folded ventrally towards the midline of the body. So that's essentially what we're looking at. And with further folding of the embryo, what we end up with is yolk sac that's squished into a tube-formed structure inside the embryonic body that's giving rise to the foregut, midgut, and the hindgut. And note where the allantois is in relation to the hindgut of this embryo. It is still within the connecting stalk or the future umbilical cord, but it is still maintaining its connection to the hindgut. And as a reminder, lateral folding is occurring at the same time. So when we make a cross-section through the folding embryo, what you'll recall would be that trilaminar germ disc form with the ectoderm, the neural tube with the nodal cord in the middle. Here's the gut tube that is getting incorporated into the embryonic body, the paraxial mesoderm, the intermediate mesoderm, and lateral plate mesoderm that has split into the dorsal somatic LPM and ventral splanchnic LPM with the intraembryonic body cavity in between. So these are the structures that you already know, and the urinary system, we're really paying particular attention to that intermediate mesoderm today. In looking at the lateral folding of the embryo in a little more detail, again, this image is essentially this cross-section, paying attention to what is happening to the intermediate mesoderm at this time. As the embryo is folding laterally, note where that intermediate mesoderm ends up being. Before complete lateral folding, the intermediate mesoderm is positioned lateral to the paraxial mesoderm. And as we're folding, that intermediate mesoderm is being brought still lateral, but a little bit ventral to the paraxial mesoderm, but dorsal to the developing gut tube. And behind the intraembryonic coelom or the body cavity of the embryo, further folding, the intermediate mesoderm is still positioned in the back side of the body, dorsal to the intraembryonic coelom or the future peritoneum. Further folding, oh look, our paraxial mesoderm is forming its vertebral column or vertebral bone, and all the skeletal muscles getting neurulated and everything. But along with that back body wall, we have the intermediate mesoderm that is still positioned dorsal to the intraembryonic body cavity or the peritoneal cavity. All this to say that the intermediate mesoderm has always been in the retroperitoneal position. So any organs that develop from the intermediate mesoderm are considered to be the primary retroperitoneal organs. Therefore, surprise, surprise, the kidneys that derive from the intermediate mesoderm are considered to be the primary retroperitoneal organs because they've always been, from the beginning to the end, within the dorsal back body wall behind or retro to the peritoneal cavity. Now, three-dimensionally, we need to remember that the intermediate mesoderm is a paired longitudinal streak in the backside of the body. So when we stand the folding embryo up like this, here's the cranial end with a cranial neural pore that is still open, caudal neural pore may have closed. Here's a yolk sac, heart bulge, and in the back body wall, we have the developing neural tube on either side, the somites from the paraxial mesoderm that are forming, and lateral to those, we have the pair of intermediate mesoderm streaks forming these longitudinal streaks in pink. Because they give rise to the structures of the urinary system as well as some of the genital structures like the gonads, the intermediate mesoderm streaks are also called the urogenital ridge, which is essentially a combined term for nephrogenic or the kidney forming and the genital or the gonad forming structures. Now, looking at just the nephrogenic ridges, which are essentially the entire length of the urogenital ridge, but mostly on the lateral aspect. Later on, around the lumbar region, separate or subsegment of the intermediate mesoderm will develop into what we call the gonadal ridges that'll become the gonads, but that will be discussed in the RLC course at the very end of your plains year. But again, just looking at the nephrogenic ridges, we, over the period between the 4th week to 12th week of development, actually form 3 different sets of kidneys. Around week 4, the cranial-most portion of the intermediate mesoderm or urogenital ridge, we form the first set of kidneys called the pronephros. Again, just the 4th week, super short duration. Then the rest of the intermediate mesoderm will over time develop into the temporary kidneys called the mesonephric kidneys or mesonephros. The length or the majority of this length of the nephrogenic ridge right now is portraying the mesonephric kidneys. Permanent kidneys will start to form at week 5 at the pelvic region. Of course, we in adult form do not have all 3 sets of kidneys, which means the pro and mesonephric kidneys will eventually degenerate, and the permanent kidneys called the metanephric kidneys or metanephros in the pelvis region will rise along the back body wall to end up in the lumbar region of the body. So let's look at that in a little more detail. The first form of kidneys, called the pronephros, form again around week 4, and they form in the cervical region of the intermediate mesoderm streak. So up in the neck region, we had pronephros or primitive kidneys. Interestingly, these pronephros, they never become functional. So pretend to form, but then say, oh, just kidding, and then start to degenerate right away. What is important about the pronephric structures is the fact that they form these purple structures in the neck called the pronephric duct. Once they form, they will continue to grow caudally along the length of the intermediate mesoderm until they get super close to the hindgut, the cloaca, and then eventually pierce the cloaca and drain into it. So the pronephric ducts are super important structures that will continue to induce the undifferentiated intermediate mesodermal tissues to differentiate into the temporary mesonephric kidneys. Mesonephric kidneys develop to form between weeks 5 to about 10-ish. They form along the length of the thorax and the lumbar regions. So these are really, really long kidneys. And the way that they form is induced by the pronephric ducts that reach the thoracic and the lumbar region of the intermediate mesoderm. So once the pronephric ducts reach the thoracic ducts, they miraculously change their name to mesonephric duct. So it's a continuation of the pronephric ducts, but around the thoracic level, they just changed the name. And by about week 5, of course, the cervical pronephric kidneys have all completely degenerated. Functionally speaking, mesonephros do function, meaning they filter the embryonic blood and generate embryonic urine. But this happens while the mesonephros are actually present. So between weeks 5 to 10, they start to function, and by about week 10, their functionality will begin to peter out as the permanent kidneys kick in. The functional components of the mesonephros histologically are the mesonephric tubules that are essentially the mesonephric nephrons that hook up to the mesonephric duct and then drain the formed urine into the mesonephric duct, which then drains into the cloaca. And what happens to the mesonephric ducts, as mentioned earlier, they will connect with the cloaca. Lastly, the metanephros are the permanent kidneys that we keep for the rest of our lives. So metanephros begin to form in the pelvis around week 5. Actually, just as mesonephros are forming, the metanephros also begin to form in the pelvic region at the caudal-most end of that intermediate mesodermal streak or urogenital ridge. Functionally speaking, although they begin to form in week 5, they don't begin to function until about week 10 when mesonephric kidneys would be degenerated by this time. So as mesonephros are going away, the metanephric kidneys start to function. So there's a bit of a handoff there. The functional units of the permanent kidneys, of course, would then be the nephrons or the permanent nephrons that form from the metanephric tubules. So way the permanent kidneys form in the pelvis is through the formation of the metanephric diverticulum, also known as the ureteric bud. So at the caudal end of the mesonephric duct that's draining into the cloaca. So this is the blown up version up here. So there's the mesonephric duct, and from it, we have a small branch that is kind of inserting into the caudalmost area of the intermediate mesoderm, which is called the metanephric blastema. This is the undifferentiated intermediate mesodermal tissue we just call the metanephric blastema. So once the ureteric bud or the metanephric diverticulum grows into metanephric blastema, the two tissues will start to induce each other or reciprocally induce each other, so that the ureteric bud will start to branch and the metanephric blastema will continue to divide and stay dedifferentiated until later. And further branching of the ureteric buds will create all the way up to the distalmost branches, which would be the collecting tubules that are inducing the metanephric blastema to differentiate into the metanephric vesicles that transform into the metanephric tubules that then transform into the nephrons that will eventually co-opt with the collecting tubules that will eventually drain the formed urine through the collecting system of the urinary system. So the metanephros form through the reciprocal induction between the distal branches of the ureteric bud and the undifferentiated intermediate mesodermal tissues called the metanephric blastema. So looking at one of these distal branches at a higher magnification, here's the distalmost region of that ureteric bud branch and the undifferentiated metanephric blastemal tissue. There's molecular crosstalk between the two tissues that'll eventually induce the metanephric mesenchymal tissues to form this metanephric vesicle, also called a nephric vesicle, which is essentially an epithelial-lined cyst-looking structure that eventually elongates into the nephric tubule, also known as the metanephric tubules, that in its distal portion will kind of start to envelope the invading vasculature, the forming glomerulus to form that glomerular capsule, and then the elongation of the rest of the tubule will form the proximal convoluted tubules, the nephron loop, and the distal convoluted tubules that co-opt with the collecting tubules that drain into the duct. So as you can see, the nephron structures have different embryonic tissue origin. They derive from the metanephric blastema, whereas the collecting tubule, the ducts, and the rest of the collecting structures like the minor calyces, the major calyces, renal pelvis, all the way down to the ureter are deriving from the ureteric bud, which branched off of the mesonephric duct. The metanephric kidneys, or the permanent kidneys, as you know, are forming in the pelvic region starting in week 5. But over the next 5 weeks or so, they won't just stay there, but instead start to relatively ascend through the dorsal body wall to adult anatomical location of thoracolumbar level. And as that happens, the ascending permanent kidneys will need to acquire new blood supply directly from the growing aorta. So in this ventral view of the developing embryo, let's say that this is about week 5 of development. On the anterior view, we see the mesonephric kidneys that are forming from the intermediate mesoderm and the metanephric kidneys that are forming in the pelvic region. So right now, mesonephros are currently filtering the embryonic blood and generating urine. While that is happening in the pelvic region, the permanent kidneys are starting to form, and over the next few weeks, the mesonephros will start to regress or degenerate from cranial to caudal direction. And as that's happening, the permanent kidneys, still under development, are starting to rise, if you will, towards about the lumbar region of the dorsal body wall. So by the time the mesonephric kidneys have all gone away around week 10 and the permanent kidneys are starting to kick in, the permanent kidneys would have acquired their adult anatomical position in the lumbar region of the back body wall, just below the adrenal glands. And as you can see, while that is happening, as the permanent kidneys are elevating, they're acquiring new direct renal artery supply branching off of the aorta, while the pre-existing lower renal arteries are degenerating. So you can see several levels of this reacquisition of new renal arteries, and the degeneration of the lower renal arteries have occurred at least a few times for the permanent kidneys to end up where they are, with their renal arteries coming off of the aorta at the appropriate level. That marks the end of this pre-work where we discussed the 3 learning objectives, and I'll see you in class.